The exercise we're now going to show you is the squat exercise. Now what sometimes we like to start off by doing is just having a little chair behind you, because how we're going to teach this particular variation of the squat is going to encourage you to use your hips and your back a little bit more as opposed to purely your knees. So with this exercise, Jill's going to stick her bum back a little bit and bend forwards at the waist. Then she's going to lower down gradually towards the chair. She's then going to touch the chair, and then she's going to stand up, squeezing her buttocks at the very end to push the hips forwards. And so if you perform another one. So as you can see, Jill's got her hands across her chest. But what you can do is you can actually then put your hands out in front of you. Finding getting your balance is a little bit difficult, then you can then put your hands out in front of you just to counteract your weight a little bit more. So again, Jill's doing a very nice job of making sure that her centre of mass is back a little bit and it's not going too far forwards to put a lot of pressure on her knees. Lovely, thank you, Jill. Okay, thank you. Okay, so this is the same exercise, the squat, but from a slightly different angle. Now, what you might notice is that Jill's got a fairly hip to shoulder width stance. Now, everybody's stance should be slightly individual. So what I'd say is maybe have it slightly wide to begin with, and if you feel more comfortable bringing it in a little bit narrower, then just have a play around. But just make sure that to start with, it's roughly shoulder width apart. And to try and have your feet roughly either pointing straight on or just very slightly out to the sides. So Jill, if you now perform another squat for us. So again, from this angle, you can clearly see that Jill is making sure that her knees are ever so slightly pointing out and she's not letting them cave in. That's essential when you're performing a squat, that you're not letting the knees cave inwards and collapsing. And what she's also doing is, as she's squatting down, she is actually shifting the weight back a little bit onto the heels of her feet. Brilliant. Thank you.